subset of this rare disease population where we've seen a disproportionate impact are young patients when they transition from pediatric to adult care, whether it's moving to a new care provider or leaving home and they're looking to take control of themselves, and that's what we want as parents in managing their disease. But what has NORD seen from that perspective, this aspect of transition, and how can the community help bridge the lapse in care that so frequently becomes a new part of the journey during that time and age?
With the advent of new innovative treatments, more children who might not otherwise survive into adulthood are going to be making that transition. And that's an exciting thing for our community. But it comes with its own challenges. You have a complex medical condition that someone who's been young or in adolescence has had the benefit of a family unit often helping to manage. And now they're having to take on that responsibility themselves. And I know how much of a pain it is to navigate my health insurance. Now, as an 18-year-old or a 21-year-old, you're being asked to pick a healthcare plan, you're being asked to address co-pays, co-insurance, you're being asked to figure out what does in-network mean, what does out-of-network mean, and that's just to make sure you can afford the healthcare that you need. That's not even talking about all of the challenges that come with educating a new set of providers about your condition who maybe have never seen somebody with your condition, or you've always gone to a children's hospital, but now you need to be seen in more of an academic medical center. And pediatricians may have more knowledge of this, but maybe an internist may not. And so you are once again being put in that position of having to educate a set of healthcare providers while managing your own condition. And that can take a pretty significant mental toll on you as well. There's a lot that we as a community can do for these individuals, that we need to, as you mentioned earlier, really be thinking about what's most important to those individuals and helping provide the support services around that to make sure that they want to stay on their treatment plan, that they have the tools to provide that continuity of care that they need to thrive. But also that these clinical trials and the post-market studies are designed in a way that will keep that individual engaged in the healthcare process, because that is critical data to future innovation and better treatments down the line. So we really have to be thinking about these young individuals who are going to grow up into adults, and how do we create a system that works for them so that they can stay on treatment and get the care that they need to really thrive.
You can see that the benefits that happen from the government regulation, the Pediatric Review Act, all of the research, they create, it's almost like the tube of toothpaste. You get a great solve here, but it creates another jam someplace else that we now need to spend time paying attention to, which is why the work that your team does in looking at policies and regulatory developments are critically important.